So, am I having mouth cancer and am I going to die?
If you do not brush properly, then it will definitely lead. Alcohol can reduce the saliva presence.
Poor oral hygiene is one of the most common cause for
So much of staining.
If you have a prosthesis, it's like an artificial thing you don't need to clean. It is never
Yeah.
like that. You have to clean.
dental treatments are not expensive, but your ignorance is.
Yes.
Hello everyone. Welcome to the first ever episode of DentCare Talks, your go-to for all things dental. Myself, Dr. Jamin Elizabeth Matthew. I'm a prosthodontist and technical manager Marcom at DentCare Dental Lab. We have been excited to bring you a variety of training and educational content on YouTube, reaching dental professionals and enthusiasts all over the world. We are grateful for your incredible support and feedback you have been giving us so far. Today, we are here to address some of the top queries and concerns we have been receiving on our various social media platforms. Joining us today, we have Dr. Merlin George, who heads the division of removables at DentCare Dental Lab. We have Dr. Lina Benny, who heads the division of implant at DentCare Dental Lab. And we have Dr. Nitish, who is a quality specialist at the division of implant DentCare Dental Lab. So I was going through the list of queries, and questions which we got in various social media platforms. And one thing I noticed, the topmost question or one thing many people had doubt on without any surprise, that was bleeding gum. So I feel in my undergraduate time, one thing many people had approached me also was regarding bleeding gums.
Yes, even with me, very recently, one of my friends, she's an engineer. So one day I'm getting a call at night saying that, Nitish, my mouth is bleeding while brushing. So am I having mouth cancer and am I going to die?
Oh,
She would have Googled it and picked up
Definitely.
the worst case scenario possible.
yes.
I was quite surprised that professional like her is unaware of bleeding gums. What do you say, doctor?
See, maybe sometimes in very rare situation, bleeding gums can be a reason for oral cancer, but it's very rare.
Rarely,
Okay, but
yes.
the most common cause, what I encountered in my clinics also and with my colleagues, poor oral hygiene is one of the most common cause for bleeding gums.
Exactly. Yeah.
There must be some other causes are there, like vitamin C deficiency, blood thinners,
thinners.
and there will be like something pregnancy related issues, and there is hormonal imbalance cases, and of course nowadays stress also can be a reason for
Reasons,
bleeding
yes.
gums.
Yes.
In that situation, so in all these so many cases, even though people are claiming that they are brushing the teeth twice a day, thrice a day, but still poor oral hygiene is a
It
common
always
factor.
stays. Period.
Oral hygiene, if you do not brush properly, then it will definitely lead to bleeding gums. But one way by which we can stop bleeding or reduce bleeding is using the right brush, and the brushing technique is very important. Yes, so while brushing, we have to use vertical strokes rather than going horizontally straight.
Which was since ages we are practiced to do that.
Doing
Yeah,
that.
we have learned
So
those
that's not
action
Yeah.
songs where we do this for brushing.
In nowadays in schools, actually, children are very much encouraged to do the brushing techniques. Even my kid says that, "Mama, round and round and round."
Yeah.
Like they know that. It's very good
So
actually.
right
Yeah.
way is just moving the brush upwards and downwards, and then covering the surfaces, the outer surface, the inner surface, and the chewing surface.
Spend 2 minutes.
Definitely, you have to spend 2 minutes.
Yeah,
And
one,
then-
1 minute for upper and 1 minute
the
for lower.
Yes,
Yeah.
at least.
And then type of bristles also play a very important role.
Exactly. Because still now in our society they think that
Yeah.
harder the bristles, better the results. But it's just opposite. It worsens the case, When we use harder bristle for a long time, it causes enamel to wear off.
Yeah.
And we all know,
yeah, it will end up in sensitivity.
seriously, because once enamel is gone,
It's
it
gone.
never comes back. So it ends up with sensitivity. Like eventually they are not able to take something cold, sweet,
Yeah.
hot, nothing. So they will eventually end up with restorations or prosthesis.
Yeah.
So better to use gentler kind of soft bristles.
Soft bristles.
Yeah.
And I feel like because of the many advertisement
advertisements we see regarding brushing, toothpaste, people are very familiar with brushing. And literature also says brushing cleans, but about 40% of the total oral cavity. But many people are not aware of flossing. Like, yeah, they do brushing, but they don't clean interdentally. Between the teeth, still food is lodging and infection is there and they're getting bleeding gums. So many people are like, because there are no much advertisements on floss,
Exactly.
dental floss
Yeah,
actually.
usually in
Yeah.
clinics and in colleges also,
Yeah.
like we are more encouraging toothbrushing techniques
Yes.
and everything,
Exactly.
but they are
Flossing
not
is-
saying
Nobody is
something
talking
about the
about
floss.
And
flossing.
some
Yeah.
people have floss, but they don't know how to use it. They don't know how to hold it, how long the twine should be. So
Yeah,
it,
yeah.
But
they find it.
irrespective of all this, I have a friend who flosses every time after the meal, but not with a professional flossing technique. He just pulls out a twine from his t-shirt and starts to floss.
Yeah.
Even he's
At least
doing
he's trying.
that.
Following
Yeah,
something.
in that sense, yes.
Floss is there. One other thing I feel like, because of so much ads are there nowadays regarding mouthwashes also. Mouthwashes, I have a friend who uses a mouthwash after every meal, which is, I definitely feel it is not right.
Yeah, people see nowadays mouthwashes is considered as one of the essential oral hygiene aids.
Exactly.
It's just like with toothpaste and floss and then mouthwashes, but people are not checking what all are the composition actually,
Composition.
or whether it
Ingredients
suits
matter.
to us or not.
That's what.
Yeah.
See, chlorhexidine mouthwashes, like regular use of chlorhexidine mouthwashes results in tooth discoloration. I
Yeah.
think barely people know that.
Even
And
alcohol
even-
containing mouthwashes, it actually dries out the mouth, because alcohol can reduce the saliva presence in the mouth. So it actually causes more caries and more dryness in the mouth.
But
And
now in the market, you also get alcohol-free
free
mouthwashes.
mouthwashes.
Yeah,
Which is
and
important.
something we have to use with diluted form, and there's some uses in a concentrated form, and that end up in a burning mouth syndrome also.
Even at colleges, when we were doing our undergraduate degree, I feel like sometimes when patients come and ask, Dr. Saab, यहाँ पे दर्द है, यहाँ पे infection है, क्या करना है, सूजन है, swelling is there. One common remedy can be considered as a home remedy, which we keep advising them was, कोसा पानी में नमक डाल के कुल्लियाँ करना है.
Exactly.
It
See, that's
is
the
आपके
most
most
underrated.
underrated.
It's most
आपके फेस में
underrated.
नमक है बोलते हैं ना.
But nowadays in toothpaste, almost
Salt is like a good antibacterial properties there, and warm water also, it increases the blood flow. It causes vasodilation and it causes increase in blood flow, which is good for some swellings will go away because of the warmth present. And salt is also good antibacterial, which can be used by everyone.
Instead of going behind the ads, one thing easily available at home. You can every day you can practice it, rather than using chemicals and alcohols. Yes.
And one question which keeps popping, even in clinics or among family members is, should I get a power toothbrush? Like,
Yeah.
because it's so much in trend and there are so much ads on power toothbrushes.
kids
Like,
are also very fascinated
Definitely, it's a
about
good
this
thing. Yeah.
power
Yes.
toothbrush.
They just have to stand and that will
That's
do
what-
the work.
Actually,
Less
it
effort.
is much
Yes.
recommended for palliative care
Exactly.
and
Those who have,
yeah.
motor
it is
function.
good.
Motor function.
Yeah, it is good for such people, like, because it's effortless. Like, we can easily clean all areas without much waste of energy. But otherwise, I feel
But it's
soft bristle-
expensive.
Yeah, if you can
If you
afford it,
yes.
afford that, you
Exactly.
can
Yeah,
use
can
that.
definitely buy
you
it.
can
Yeah,
go
but
for
it is not a must thing.
definitely. I feel a soft bristle brush and a gentle toothpaste, a pea-sized amount of gentle toothpaste is sufficient for good oral hygiene.
Yeah, but in ads sometimes they will show like toothpaste which is from one end of the
Into the
toothbrush
other
to the other end.
Actually, it's pea-sized.
Yeah, it's
that's all
it's
necessary.
just only
Just an
required.
They just
ad
wanted to empty the tube
gimmick.
and want us to buy another tube as early as possible. So yeah.
And I feel cleaning oral cavity is very important. And at the same time, cleaning of a prosthesis present in your mouth is equally important.
Exactly,
Because some people
exactly.
believe that if you have a prosthesis, it's like an artificial thing, you don't need to clean. It is
Never.
never
Yeah.
like that. You have to
Maintenance.
clean.
The other day,
Yes.
one patient came to me and he had just come to me for a checkup, and I just checked his denture. So I could see so much of staining on the denture, and then I asked him, do you maintain it? So he was not aware of the maintenance part. So yes, we have to maintain our prosthesis. That's very important.
And in market, many cleaning
Aids,
aids are available,
Yeah.
like denture cleansing tablets are available. Brushes
brushes.
specifically designed for
Exactly.
denture is available.
Yes.
No, I think
So
most
that
of the
way, if
clinics
you-
give a denture
Yeah,
kit.
nowadays they are giving denture cleansing kits, and also they have
Yes.
a service like option. There is ultrasonic cleaning methods of dentures which is available in the clinic, so patient can utilize.
What do you
utilize
say,
all
doctor?
that.
Like when
Yeah.
we are at home, how can we easily, like, may the general public wanted to know how.
Yeah, actually, if you're using a denture, one thing is after every meal, they have to clean the denture. The denture has to be placed in just normal water is more than enough. And yes, as you said earlier, like placing a denture cleansing tablet, it will be very nice.
Some people will ask like whether I should it clean with toothpaste or like
Or,
soap
Soap
solution.
detergent
I
or
think if they
Yeah.
can't afford a cleansing tablet, a soap solution and a gentle brush, a soft bristle brush is adequate.
More
Most
than
of the
enough,
cases
yes.
in Indian culture or like our food is mainly contained with a lot of spices, and
Spices,
especially
turmeric.
will be
Turmeric.
there, and it will
Stain
be
our
Yeah,
stained
that will
easily.
stain fast.
Yes,
But
yes.
then we right now have flexible dentures which does not stain.
Yeah,
So
like
they can. That's
DentCare
one
Flex, yeah.
option
Yeah.
they can go for.
Normal acrylic is more porous, so
Porous,
it will
it can
absorb more
cause
stains.
Even in that matter, even zirconia is a very wonderful material. Actually, it is very resistant to staining and all other
Yes.
discoloration. It's a very good material in that matter.
Yeah.
Okay, and regarding the bristles also, they don't want to wait up to till opening up all the
Yeah.
bristles of the
Most of the people
toothpaste.
are very hesitant to change their
Yes.
brushes. Like even
So
after
the brushes should be changed maybe after 3 to 4 months. But once the bristles have totally worn off or it has become like a flower
Flat.
shape,
Yeah. And
it
is
has to be
actually
discarded.
yeah, it is an indicator of wrong brushing technique
brushing
also.
technique, maybe they are putting too much pressure.
Okay.
Yes.
So when we discussing about implant prosthesis, nowadays everybody is
Yeah.
it is the most upcoming and trending dental prosthetic
demand.
treatments on demand.
Everybody wants everybody wants a full mouth implant.
Nobody wants to change it every now and then. So
Yeah. So yeah, it has a good result or successful longevity prosthesis it is. But maintenance part is very important related to implants. Especially we have to prevent peri-implantitis. So in market there is interdental brushes, multi-tufted brushes are available to clean the implant surface, and also you have to clean the area below the prosthesis,
Yes.
Yeah.
especially
Most of them
where
don't
food
know that.
debris are
Yes.
getting
Yes.
collected. So you can use interdental brushes, and you can use specified unwaxed implant specific flosses can be used. And nowadays I also prefer these water jets,
Yeah.
like water
Yes, yes.
flosses.
Water
It's like
floss.
water pick. That is like a high frequency propagating water can clean all the debris.
See,
So
people,
yeah.
people think that once they lose the tooth, once
Yeah.
they place an implant, it's done and
It's
dusted.
done,
No, it's
yeah.
not like that. It's the beginning.
Yeah.
See, because if food debris get lodged below the crown surface,
Yes.
it can eventually come back to bleeding gums,
Yeah.
Inflammation
Bleeding
of
gums
gums.
and
bone
halitosis will
Yeah.
be there.
recession.
Recession.
Then it will result in bone loss.
Actually,
Eventually,
implant prostheses are such wonderful processes. It can be considered like a lifelong.
exactly.
Only
Yes.
if they take care and
Proper-
maintain it properly.
Yes.
Like
Sometimes
up
see all
maintenance.
doctors from most of them are preferring screw retain prosthesis. So actually it is supposed to take
Yeah.
out of the mouth and clean
Clean it.
it properly and put it
Yeah.
back. So that's why
Retrievability is there.
retrievability.
Post-operative maintenance in case of may be implant, may be removable processes,
Or crown
and bridge, whatever it is, post-operative maintenance stays at first. It should be given first priority. Period.
even studies shows that up to first 10 years the success rate of implant prosthesis is up to 95%. So it's like a good prognosis is there, but only if the patient is ready to maintain it. The hygiene has to be maintained, because once the implant prosthesis is placed, patients believe it is done, like you said. But I believe the bone has to be preserved. The bone health, the gum health, the oral health has to be maintained adequately, so that it lasts longer.
Yeah, it's just like dental treatments are not expensive,
Yeah.
but your ignorance
Ignorance
is.
is.
So unless and until whether it is a natural teeth or a prosthetic rehabilitated oral cavity, we have to maintain at most level to get the good results.
And we can actually conclude saying not just the treatment part, the maintenance is equally important, or
Very
definitely
true.
regular follow-ups, regular checkups has to be done. We have so many things in the market for oral hygiene, aids are available. We all should avail it, use it, so that we can keep smiling and have a good oral health. So it was a wonderful session, and we had a very good talk and discussion. I believe it was very helpful for me and for many viewers who are watching. And I hope to meet again with
Definitely.
another
Yes.
meet again with a wonderful topic. I hope it was helpful for everyone who is watching. Thank you for watching the show, and see you again.